I'd like to acknowledge the Ngunnawal people as the traditional custodians of the land that we're meeting on today. And I pay my respects to their elders past, present and emerging, and acknowledge other people who have connections to the land. I recognise their ongoing contribution to our region and their connection to land, water and culture. And I also welcome and acknowledge Aboriginal and Torres Strait Islander people joining us this evening. So just a quick housekeeping. Bathrooms are immediately out to the left, out the doors here. You do need to push the green button to get out. You'll also need to grab one of the visitor passes that's just on the front there, just to get back in again, and then pop it back there. In the event that we need to evacuate the building, we can all just move to that end of the building and there's a fire exit and down and out. You've grabbed your food. So our event this evening, privacy, trust and cybersecurity, what practice managers and owners must know in 2026. And Gail has a jam-packed evening full of information for you. And we'd like to thank Avant, who is for speaking tonight and supporting the event. So we do have two speakers tonight. Ms. Gail Wang, who's a risk advisor with Avant, will speak about privacy and cybersecurity, and Michaela, our project officer, will just talk really quickly about better, faster access at the end. So introducing Gail. So Gail began her career as a registered nurse specialising in emergency nursing, and she later expanded her expertise by successfully managing her own catering company for 7 years, developing strong business and operational skills. This experience enabled her transition into health and business management across a broad range of disciplines. So Gail has managed day hospitals in gastroenterology and oncology and has led the establishment of new greenfield practices and merger acquisitions across IVF, ophthalmology, corporate health screening, oncology and allied health. Wow. She also brings extensive experience in accreditation and compliance, including the NSQHS, ISO 9001, Food Authority, RACGP, New South Wales Health and NATA. I don't know what that's.
NATA.
Thank you.
Yeah.
So without further ado, Gail, please.
Thank you. Thank you for having me tonight. Thanks for coming, guys, because I know that at the end of a busy day, you probably don't want to come and come out, but thank you very much for turning up anyway. So is anyone who, when we talk about privacy in cyber, what's the first emotion that it evokes in you? Is it fear? Is it, oh crap, what do I not know? What if we have a cyber incident? It's generally the way it is. I see a few of you nodding your heads. And I think as practice managers, you have such a tough job to do. It's so hard. You have so many hats on, and this is just one of them. And I so appreciate that. And hopefully you'll go home with some tools within your kit that will help you. Go through privacy first, then we're going to go through a bit into cybersecurity. So what is privacy? Well, there's big, long definitions, but what we say is any information that you handle that can identify a person, any information, whether it be, we can go into the personal versus sensitive, but it doesn't matter, right? In the reality of things, it doesn't matter. We need to store it and use it appropriately and according to the legislation. So who needs to comply? It's every business in healthcare. That's it, end of story. Everybody has the same obligations. If you're a sole practitioner practice, or you are a big, massive group with like 10 practices, you have the same obligations under the law. There is no difference. So it's really important to remember that depending on the size of your practice, you've all got the same obligations. So privacy, confidentiality, I'm going to presume that you know a whole lot of this stuff because you are practice managers and you've been around for doing your job for a while, you know this stuff. So we're just going to briefly go through this so we can get into the hard stuff. Confidentiality is an ethical duty. Privacy is your legal obligation. And then and the patients always have a right to their medical records. Or do they? Question we'll ask later. So we need the APPs. Who's heard of the APPs? We all don't look at me like you don't know what they are. Do you all know what the APPs are? Yeah? Who doesn't know what the APPs are? Okay, hopefully by tonight you've got some really good grounding in what to go and do some more research on. So it tells us what the purpose is, who will have access, what the information will be used for, who will be passed on to, and the consequences of refusing access to that information. So we're going to go through a lot of that, some of that tonight, and we're going to go, hopefully I'll give you a few case studies as well along with that. So first thing we need to look at in your practice is, who are you really talking to? Who's a GP practice here that's accredited with the RACGP? A few, and the rest of you are specialists, and then we've got one physio practice. No, what are you?
Oh, I'm very new, so I'm not entirely sure.
Oh, okay, cool. So 3-point ID check. The RACGP, those in general practice, the standard 5, you have a 3-point ID you're meant to do with a patient when? Any touch point. And what are they? DVA number, name. Some of these are right, some of these are wrong. So I'm just going to throw these up here. Now, one other one that's in there, that's not in there, is multiple births. It's the number that they are of the multiple birth. That's actually another identifier. Just so you know, it's never written anywhere, but well, it is because we know it, but it's not, you won't see it anywhere. The National Safety and Quality Commission also talk about 3-point ID. So if you're a specialist practice, it doesn't matter, you'll still have to do it. Every transaction that's on the phone, scanning and attaching documents, all need to be checked to make sure they're correct. I can give you some horror stories about that going wrong. Reading documents in the file, always double check to make sure they actually belong to that person. We're not going to go to what constitutes patient ID because I'm not going to insult your intelligence because I know that you all know that. So consent for patient handling information. So what is consent? There's implied and express consent, correct? But we need to get express consent for a patient collecting their information and how we're going to use it and store it and all those other things that we talked about a little bit earlier. We need to make sure that it's specific. So how often do you gain that patient declaration to say, yes, they consent to that? How often do we do that? All the time?
When they ask something, they have.
Oh, no, not that. I'm just saying, yeah, so in the patient registration form, you normally have there a little privacy disclaimer, and you would then say, so how often do you redo that? Yeah, yep. Do you do it on an annual basis, every 2 years? If you're a specialist practice, every time they come back with a new referral? No, just, I'm not going to tell you when and what to do. I'm just going to give you some food for thought. All right, it's just food for thought about how you can do it. So we're going to go past all that. So what information is covered? So when I talk to you about information of the patient, the first thing we always think about is digital, correct? We always think about keeping the digital information safe and secure. But it also covers the verbal, it also covers the written. Anyone still doing paper records at their practice? Okay, so I'm so sorry for you. So we need to remember that it covers patient records, but we also need to remember it covers your records or the employee's records and the business records. So when we talk about privacy, we talk about all that. Okay, so when we talk about the verbal, anyone had a privacy breach in the waiting room? Yeah, do you want to tell us what it was? Yeah.
I've done a practice on it. It's not having a privacy breach in the waiting room.
Yeah.
You can, someone accidentally says first name, last name out loud.
Yeah.
It's a privacy breach.
Yeah. Well, it depends on the consequences and what happens with it, right? So we get quite a number of claims, and we had one back in last month because it's still February. Again, when a female came in and they asked for the identifiers, doing all the right thing, gave them their phone number. This guy in the waiting room took down the phone number. This is not the first time, it happens multiple times. Calls them later, sends them a text message, hey, you want to catch up? I saw you in the doctor's waiting room. This happens. Seriously, this happened last month. We had another privacy breach because of that. We probably get, if not daily, multiple per week. privacy breaches. Well, so this is what we then go and say, because the RACGP standards state that you need to give the whole phone number. I know, and so, but common sense says, does it end in 1, 2, 3, right?
Not with 2 other forms of identifiers.
Yeah, that's why we do 3 forms of identifiers, right? Yeah, so it's really important just to remember, and what I want you to think of is just remember that this can happen in the waiting room. Another case we had was the beautiful receptionist was very caring of this elderly man. And when she came out, she said, look, I'm so sorry to hear about your cancer diagnosis. If there's anything we can do, please let us know. We're here to help you, or pop you in the doctor whenever. Being absolutely beautiful, except the neighbour was listening. So the neighbour went home and knocked on the door and said to the wife, I'm so sorry to hear about your husband's cancer diagnosis. She didn't know. I can keep going on. There's so many kinds of verbal breaches of privacy that happen in private practice, and really remember that and keep that in your head. What is one way? Anyone got any ways that you think you could help minimise, besides saying, yeah, do 3-point identifiers and don't do the whole phone number out loud, to ignore that one? Any other ways that people have put into practice to help prevent that?
Yes, ma'am. We're trying to get it done now so that we ask them to validate like an OTP.
Yep, one-time password. The OTP is one-time password for those who don't know. Yeah, so some practices I've seen are using QR codes now to scan in. The patient scans in with a QR code. You know, I don't know, I haven't actually seen it in use. I just saw it when I walked into a practice. Oh, that's interesting. It's the only practice I've seen it in so far. Some really basic things are just to sit in the waiting room and get your staff to sit there and go, what can you hear? What volume can you start hearing things? And so they've got a bit of an indication of what people are hearing in the waiting room. The other one is to play maybe some soft music, voila, the soft music we had earlier, because that does tone down. Now, we could say put some soft furnishings in there, but we know we're a healthcare practice. It's got to be infection control. So that's I've heard people say that, and I think that's very impractical in your setting.
Isn't it in that section? Yeah.
Oh, sorry. They're just, okay, no worries. Okay, so has everyone kind of got an idea of some of the issues that happen in those areas and what you have to, under your policies, have? Just want to flick through here so you got an idea. Clinical records and confidentiality is this one. That's complaints at practices. It's pretty big. Pretty big. If you haven't had one in the last 12 months, you're either doing a superb job or you're not being honest, one or the other. So anyway, and the most reason of cause of it is use and disclosure. So we're going to go into that a little bit more, how to prevent that and how to look at that. That's just to give you an idea of the kinds of claims and complaints that come through. Now, accessing a medical record. This is one of the really big ones that we have. And it's generally around the children and separated parents. The Gillick's competence. Anyone knows? Who knows? Who can explain? Yep, go. Tell them what Gillick's competence is.
Mature minor.
Mature minor.
It has to be set at each incident. So, like the standards for having surgery is different to standards to accessing medical records.
Yep. So sometimes you'll get a 14-year-old girl who's coming in and wants to go on birth control, doesn't want her parents to know. So that incident, she goes, don't tell me, I don't want mum and dad to know, I want to go on it. And the doctor's deemed her capable of making her own health decisions, which is called Gillick's competence. So that age group, 14, 16, 18, depending on the age of consent and depending which state you're in, can be quite tricky for doctors. Because you'll find that the parents will then come and complain when they find out something later on. If you do get one of those, just a little word of warning, make sure the phone number isn't the mother's phone number to confirm appointments and all that with, because we do have those privacy breaches as well when they hit the Gillick's competence. The other one is the senior patient who the children who are looking after them want to access the medical records. Can we give it to them? Can we tell them what it is? Can we tell them when the appointment is? What can and cannot we say? How often do we go, okay, the daughter came in last time, so we'll just tell her everything that's going on? We had a privacy breach recently where the secretary thought it was the usual daughter that came in, but it was a sister. They sounded similar, didn't get 3-point ID on who it was, and they weren't speaking to each other, and there was a big privacy breach there. So what do you do?
Or you make future friends.
Yeah, you can give us a call. Yeah, absolutely. So what do you do? Consent. How do you get consent from the patient? Yeah. Yeah. So there's different things you can do. Separated parents, obviously, sometimes you've got issues there with court orders, and they're very straightforward, which is good because they're really easy to do. Gillick's competence, just make sure that the doctors let you know that they've been deemed Gillick's competence for this and that you check all the information. Separated parents, both parents, who has kids? All your GP clinics would. Any peds, specific peds? So you have issues with separated parents going, I don't want that to happen. Don't do this, don't do this. And they're fighting at each other. We can send you a template of a consent form, not consent form, an agreement with the practice and the main caregiver and the other parent to say who's going to be the main caregiver, who's going to be who's going to be responsible for XYZ, and who's going to be financially responsible. So we do have templates on that. So if you do, just see Mike afterwards and we can send that through to you. Now, the elderly, what do you do with the elderly if the elderly requesting? Get there. Yeah, you can. What if they don't have one? Well, not really. It's just the same thing. It's like asking the patient who's still cognitively capable, asking them the same thing as you ask, it would be, who has this, I nominate this person for access to appointments only, or appointments and all my records, appointments, records and finances. So it's the same kind of thing. Absolutely. I'm hearing you totally. Yeah, it's really tough, isn't it? Yep, exactly. So I'm going to spend a bit of time accessing medical records because it's the big thing we get called on all the time. Can we access medical records? Our lawyers will help you in the first instance, and then we can come and do, if you've got a advanced practice policy, we can come and do a talk on this whole thing with all your staff so they're all fully aware. The big thing we have is inappropriate access to medical, can you just put a barrier in front of me? Inappropriate access to medical records. So what do we mean by that? What does your privacy policy say? Who can access your medical records? When can you, in your role, and when can your staff access the patient's medical records? In the course of delivering healthcare. That's the purpose, going back to our Australian privacy principles, of why we collected the information. It's to deliver healthcare. So, do you want to hear a good story? Okay, let's do a good story. We love good stories, don't we? So this is because it's a practice manager story. So a GP practice in a rural, semi-rural town, more than one GP practice there, they were treating their own staff. Who treats their own staff? Please say no, because come and see us later and we'll give you some information on why not to, unless you're in a rural zone where there is no one within 50 kilometres. Well, that's just an arbitrary number. So this staff member had a really good friend, husband and wife. They split up. So she thought, I think I'm going to help her. I'm going to have a look in his medical records and see what I can find there. So she did. She found a mental health care plan. Found information from a psychiatrist. So she gave it to her friend, gave it to her lawyer, and used it to access and get control of the children. So he couldn't have that. So what do? You're a practice manager and you've just been made aware of this because he knew that the only two people that knew about that was the GP practice and the psychiatrist, one or the other. Both got investigated. GP practice was at fault. What do? What do you do with that team member? Sorry?
Just breached them.
They breached. What would you do with them though? Would you just go, oh, you shouldn't do that? Yeah, you'd stand them down. Okay, great answer. Exactly what they did and exactly what they should do. However, she went to Fair Work. Why? What did they go to Fair Work for? Unfair dismissal. Did she win? Yes, she did. Why? No, confidentiality agreements is just part of the process. She hadn't been trained since she started. Okay, so we're going to go into this a little bit later, how important training is for your staff. So really think about that. We're not going to do these scenarios because we're going to run out of time. So I'm going to flick through these because we kind of did those as well. Okay, so a privacy policy. You all have a privacy policy? Yep. Doesn't matter where you are. Who doesn't have a privacy policy that has a website and it's not on their website? Everyone's got on their website? Excellent, because this year the Privacy Commissioner has extra manpower and they're focusing on privacy policies on the website to make sure they're up to date. Okay, so really make sure, go and review it and put a new review date on it. So again, this is the purpose of it. Now the difference here is the use of AI in the practice. The new legislation that came out, who knows all about the new legislation that came out at the end of 2024? This is why you're here. So, first Cybersecurity Act of Australia. Yep, everyone remember hearing about that? Yep. Everyone remember hearing about there was changes to the APPs, number 3, 8 and 11, I think off memory. We'll go through those in a little bit and what they mean to you because they have significant impact in your business and the way you manage the business. Significant impact. And also about AI. So you've got to have the use of AI. I presume you're all using AI of some description in the practice. It doesn't matter what AI you're using, as in whether it's a scribe, whether it's sorting documents, whether it's to answer the phone, doesn't matter. Whatever you're using, you just got to have AI there. Okay. So I always say to have a privacy policy for your staff. You can kind of have it separate or you can have it integrated in whatever other policies and governance paperwork that you've got. But they need to understand what privacy is. They need to understand their obligations for training, how often they'll have to undergo training. They'll need to understand in that when they can access medical records, because we see this is the big problem with staff, is accessing medical records when not in the duty of delivering healthcare. Accessing medical records belong to staff members, family, friends, all that kind of stuff. And the consequences. So we'll go into the consequences in a little bit. So I think these are all the kinds of things. We can send out this slide deck so you can get all this. So we won't go through them one by one. What we need to do, how else you ensure privacy in your practice. So it's just really important just to remember it's verbal, digital, written, and keeping them all safe and secure. And you just need to just keep remembering that, and there's severe consequences these days. Here's your APPs, Australian Privacy Principles. Who's heard of the OAIC? The Office of Information Australian Commission. Yeah, everyone's heard of that one? Yep. Okay, they put out the APPs. This is what they do. These are the changes that were made in it. 1, 11 and 8. I said 3. Sorry about that, I led you astray. I'm not going to go into that one. What I want to do is go into this one only, because this one they haven't put out. Most people don't use overseas stuff. So number 11, APP 11 is all about taking reasonable steps to protect the information. But what they added this year, what changes it is this: the technical and organisational capabilities. So the technical, we all kind of get it, don't we? It's like we keep we have an IT system, we keep that safe, we do our backups, we do all that kind of stuff, put firewalls in. We've got the technical capabilities. But then we've got the organisational. And they specifically name 3 things in that. One is culture. culture of reporting. You need to have a culture of reporting within your business. The other one is your governance and your policies and a cyber framework and a privacy framework. Okay. The other one is training. Let's get back to the good old training. It is written in legislation, you have to train your staff. Now, governments don't give us timeframes to do that, so we just have to arbitrarily decide how often we think that will be. We've always said at least annually, and if there's an incident. That's what we would recommend, but don't leave it any longer than that. So this is now legislation for you guys. Now, the little curveball that they've thrown into this, it says training for employees and, have a guess, contractors. That means all your doctors. Good luck. Because I work with them and I know how hard it is to get them to do anything that's not clinically related. So that's actually now, it's written in law. Yeah, I know. So good news though is come and see Mike afterwards, give me your name and number if you haven't put it down there, because we can send you some free links. But if you've got an event policy with us as well, we've also got some resources that give you a certificate, some learning modules that you can do on privacy. The other one is if you've got a problem and you need to have some on-site education or some one-on-one with your practice, let Mike know and we can organise that for you as well with the practice policy. So there we go. I think I did that really well. That was a really quick overview of privacy and the changes. So we're going to talk about cybersecurity. Who thinks they've got a great cybersecurity framework because they've never had an issue and they're doing really well? And I hope you all think you are doing really well. And I hope at the end of the night you're going, that was a breeze because we're doing it all. Yeah?
Cybersecurity, but
Yep. So why do we need cybersecurity? In healthcare is the most, healthcare, you've moved the camera. Healthcare is the most, we have so many small practices everywhere that we are a very immature group of people that work in this industry. So when you look at banks, when you look at other big companies like Qantas and all that, they're one big company, right? Much easier for them to have a really good cyber framework. A big health company is much easier for them because they can pull on the resources and do it. You guys, it's you. It's your next little hat that you put on. You need a cyber framework, but you also need a cybersecurity officer and a privacy officer. And I'm presuming that's all of you. You all wear those hats. Correct. So that's just the kind of cost it is to the economy. And a third of Australian healthcare organisations, only a third, embed cybersecurity awareness into their policies and procedures. So this is why they had to legislate stuff. It's not because they wanted to go, you know, people were doing the right things. People weren't doing the right thing. So that's why they had to put in legislation in writing. So 58% of breaches happen when there's been a patch available, patch update, same thing. Yep, there's also some news about that one. It needs to be done within 7 days. But as we all know, who's got best practice? Who got stung with the update about a year ago? Just over a year ago when it was losing medical records and deleting information and not restored? No? Oh, you're lucky. Okay, so a privacy breach, just around that, just for your knowledge, privacy breach includes lost data. So if your system loses data, so changing data, you can't edit, right? You can't remove data, but it's also lost data. So a lot of people forget that that is actually a privacy breach. Yep, you're nodding, going, yep, you've had that?
Yes, we had some incidents where people posted wrong accounts and the other page data is missing.
Yeah,
It's possible.
yeah, yeah.
One and other one.
Yeah, yeah. Look, we do get the occasional call and go, help, help. On my last week's dictations didn't save and I don't know what to do, and or I've lost my last week's medical records, I don't know what to do. So we do get the occasional ones of the
Capacity to identify medical records.
all they knew was that they had some were lost, but they couldn't identify where it was. So they were working with practices and everyone knew about it. So it was one of the updates that happened. Now, cybersecurity, we're going to, yes. No. Yes.
An addendum, and you've noted that because you inputted the information incorrectly. So
Oh yeah, that's fine. That's fine. You just can't delete anything there. You just write written in error and the date that was written in error, and then off you go. Yeah. And that's always been the case when I was nursing in hospitals. It was always the case. So, and I often did write it in the wrong patient note. So I wrote that quite a few times. Now we're going to talk about the Swiss cheese of cybersecurity. Anyone heard of this? Yep. Great. Sometimes they generally don't. So the whole thing about Swiss cheese in cybersecurity is there's a minimum of 8 layers that you are expected to have in your practice. And the 8 layers, we call it Swiss cheese because to me it's a really good, who's visual here? I'm very visual. You've got Swiss cheese lining up and the holes are always somewhere different, right? So getting them all to line up, so a threat actor, which is what you call someone trying to breach into your system, that they're called threat actors, coming in will get through the first hole easy. Well, there's the second way I can get, the third, fourth, fifth. They're not going to, it's too hard. They're going to leave you alone. They're going to go to someone else because Joe Blow down the road, super easy to get into. Super, super easy, right? And this is the problem with immature cyber frameworks within healthcare because the smaller you are, the harder it is. So, Essential 8. Who's heard of the Australian Signals Directorate? Yep. And do you use it? Because it's an awesome resource for you. Have you heard of the Essential 8 from cyber.gov? Okay, these are your 8. So we talked about patch applications need to be done within 7 days. So your IT security person should be doing that, who you've got someone doing that all for you. We talk about application whitelisting, so banning certain websites that people can't access, all that kind of stuff. The IT person will be able to configure the macro settings. Then we talk about restrictive admin privileges, only giving them to certain people who actually should have access to that. Not everyone has full carte blanche across the whole system. So you as practice manager would have access to a whole lot more information than an admin support person at the front desk, right? So that kind of thing. Patch operating on patch, we got that twice, I don't know why. Multi-factor, who uses multi-factor or dual factor authentication? Yeah? Who doesn't use it? Logging on.
Just the main software.
Yeah. So who's got doctors that work from home, work remotely?
We do.
Yeah? Yep. And do they log onto a VPN?
Yeah.
Yep. Excellent. Because I tell you what, 12 months ago, most people said no. So I'm really happy with that. Daily backups. Everyone do daily backups? Do you test it? You do. The rest of you test it because that's part of what you have to do. You have to test it as part of the Essential 8. If you go to cyber.gov, again, we can send you the links, but you can also look it up. So cyber.gov is under the Australian Signals Directorate, and they have loads of really, really good resources. They have how your business preparedness for a cyber attack. You can go in there and do that. They have what's called exercise in a box, and you can go through it and see where your weaknesses are. It's kind of like a gap analysis for your business. It's really, really cool to do. So there's some really good resources on cyber.gov. So the Australian Signals Directorate put out twice a year a security threat report. Some of this information we'll give tonight come out of that. It only came out just recently. It's really exciting. I love reading it. It's really cool. So they talk about in all the new cyber framework, it's all about resilience. It's building up resilience within your business. So all this is aimed to give you resilience. So if you don't have some of this, then that's okay because you're going to go home on your risk register and you're going to write, this is what we need to look at more. Our action items, we're going to investigate this more, do a gap analysis, see what we need to do. You don't need to go and do it next week. but you need to at least identify it and start working on it. Okay, what is a cyber attack? Anyone had a cyber attack? No? Serious? No one? Yes? What was yours?
Oh,
And were you held to ransom?
no.
Okay, all right. Okay.
Of course, havoc.
Yeah, it does, doesn't it? So this is the different kinds. There's lots of different kinds. You've heard of viruses. You've probably heard of spyware coming in. You've heard of scams, phishing, smishing, vishing, and quishing. So long as we are aware of all those, and that's like SMS, it's emails, it's QR codes, it's all that kind of phone scams, all that kind of stuff. And then we've got coming up malicious software, which is what they put into your system. So again, we'll send you the slide deck. You can have a look at this a little bit more. Then you've got the worm that replicates, ransomware, and then you've got the Trojan horse. So a really cool thing to, maybe it's not that cool. AI now, a lot of the people trying to get into your system are using AI, right? So more and more, because they can hit loads of places at once, businesses at once, right? So they're using AI. However, this is what I love about the Australian Signals Directorate, is they're using AI to see where their weaknesses are in business to try and help businesses and sort of see where they can go in. They know who the threat actors are. They know who the ones coming in. Do you want to hear another really cool story? Who got caught up with the no? All right. Yeah. Who got caught up with the Medibank scam? Lost data? Yeah. Anyone else? No one? Oh, that's really cool. Do you want to hear it anyway? Okay, let's do it. So millions of Australians got their data compromised and taken by these people who came in and took their data. Same with the Qantas one, exactly the same thing happened. Qantas was through lack of identification of a patient in a member of Qantas in the call centre, and they managed to change the password and got in. So Medibank, I can't remember how that one actually happened, but what they did was the Australian Signals Directorate, they tracked the people who they thought, which a new group of cyber terrorists, thought who they were. They were monitoring this group of 5 Russians, 300 kilometres from the Kazakhstan border, and they were watching them. There's always someone there. So they couldn't get into their system because obviously they know IT. So as soon as someone got into the system, they just, shut you out. So they'd be able to do that. However, one night, these 5 individuals decided to all go out together and have a party down the road, have a few vodka shots, whatever they were doing. So the Australian Signals Directorate went in, got the data, wiped all the data from their servers and their backup. Wiped the whole lot. While they were in there, they wiped everything else. So it belonged to other countries. They just got rid of everything that was in there. So they came back and it was empty. That's what the Australian Signals Directorate go and do. We don't hear about that. There was a news article, but I've heard that directly from the Australian Signals Directorate themselves. Cybercrime for your business. These are your top 3 issues. Emails. We call them BEC, business email compromise. Who's had an issue and a privacy breach with their emails?
Right. Oh, it's payroll day. Would you please update my, and it's to me.
Yep.
Hi, Kylie, from the website.
Yep.
From Dr. Ben Jacobson or Dr.
Yep.
Blah, 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 blah.
Yep. Yeah, they're really common because they can go on the website and they can go, oh, that doctor's working there, and I'll try. And I'll tell you, it works. We have practice that go, can we get the money back? Will you pay us the money back? No. Oh, yeah. Yeah. Yeah, I've been working at a practice that lost $20,000 as well. So really got to just be aware of the business email compromise. And why do they use it? Identity theft. I had recently had a doctor who rang up and said, help me, help me, help me. I've just been, a patient's rung up and I was telehealth and I gave them a script for S8s, but it wasn't that patient because when I sent the invoice and they actually sent them their hospital discharge letter, they had all the documentation. So on telehealth, he luckily had documented his 3-point ID check and it was an identity theft from a cybercrime. And so he cancelled the S8. drug straight away when the real patient said, I have never called you and I'm not paying that bill. So really be aware of those kind of things. The cost of cybercrime, just sort of throw it up so you can get a bit of an idea. See the rise if you're a small business or medium, see the rise every year. It goes up and up and up. So it's really costly for a business to not have a good cyber framework, as well as now, if an individual or a business willfully discloses information, it has a privacy breach and it has consequences. And if you have a lot of people having a consequence, you are most likely to have someone's going to have a bad outcome of that information being stolen. If it's an individual, like the one I gave earlier of the staff member, the fine now, anyone have a guess what the fine is up to for an individual? 2.5. For a business, 50. Okay, so that's willful and it's got to have a severe consequence to the person whose information has been breached. But we don't know what their parameters are and what their guidelines are within that because we haven't seen one yet because it's all so new. So we don't know what it is. But that's something to go back with. So why do we spend money on doing it? Because it's going to save us money in the long run. And you're also meeting your legislative requirements. Now, this is the first year ever where healthcare has fallen just below financial. Ignore those two because that's government. So in the private sector, we were always on top. And now financials have got on top of us, which is not good for us when we've got a lot of information stored at the banks and stuff. However, that doesn't mean our incidences have gone down. They've still gone up, okay, because cybercrime is on the increase in Australia. So we talked about that one. So then we talk about the cybersecurity framework. Who's got a who would call what they've got a cybersecurity framework? You got policies on, you got all the policies that we talked about. You got an email policy. Okay. If you sit in the office, because you're all in the office today, weren't you? So think about, look at your, because business email compromise is the main form of a privacy breach or a cyber breach. And by the way, that can just be one of your staff members sending an email to the wrong person. And we're going to talk about ways to mitigate that risk. So when we talk about business email compromise and your safety of your the emails, how many emails would be in the generic reception admin info at inbox? Do we have any takers on 1,000, including all the files, anything you can access? Sitting in there. Sitting in there. Any takers? 1,000, 2,000? Going up? We going up still? 3, 4?
File as action.
File, neatly filed away. Doesn't matter where it is, because if you can access it, a threat actor can access it. Why? So what I want you to think about, why have you got so many emails in your inbox? Yeah. So I had a practitioner who was a sole practitioner who found out from a patient who emailed him and said, hey, I think you got something wrong with your inbox. He had a Microsoft business account. He thought he was safe. They all got spam. So every single email, 5,000 of them in his inbox, was then deemed to be a potential compromise of patient privacy. He then had to go to the OIIC because it was a reportable event. Everyone know what a reportable event is? Send it. You call us if you've got an event policy and we'll help you through that. So he then had to report it to the OIIC. They then said to him, this is before the actual new penalties came in. So they said to him, okay, you need to contact every single person whose information could have been compromised in that inbox. 5,000 of them. Could have been more because there's theatre lists in there, he's a surgeon. Right. He then had to show the OIIC that he'd done that. He then he took a week off work, had to cancel all his surgery. He had to engage lawyers. This is where all this cost comes into it because he didn't have a cyber framework. He didn't have the essential. He just thought it was safe, it was okay, it was good because it was a business thing. Business email compromise is costly. So how long do you keep your emails for? If he had 100 in there, may not have been a reportable, only there for the last little bit. He's thousands in there, it's then a reportable incident to the OAIC because you cannot guarantee that one person, you only need one person will have a consequence out of that breach. So think about your email policy and how you're going to do that. Okay.
Does that go with, when you've got, where you delete the email, but it stays on the server, your company, you can go back and backtrack, even though you've deleted out of your outbox or inbox, you can always go back where we.
That's an interesting question because no one's asked me that before.
Because we can go backtrack many years.
Yep.
Even though we've deleted it off the main.
Yep.
Or you can actually go
Okay.
and get it.
So let's go back to why we collected the information. Okay, so we collected it for the purposes of healthcare. And the period is until it is no longer required to be used, or there's a state legislation on the minimum number of years you need to keep it for. So we go back to that. So if you have a breach and your server, is it a physical server on site? Or is it in the cloud? Okay, physical servers, we've known them to go missing. So always be careful of that. So just always go back to why you're keeping it, because you shouldn't be keeping it any longer than you need to. So if you've got theatre lists going back from like last month, 2 months, 3, 4 months ago, you never access anymore, why are they still sitting there? Because that's a really big risk to your business. If you know that if you get an email and it's got an attachment and it goes up into the patient file, why are you keeping that email any longer? So it's all that kind of stuff. I just want you to think about how to do it. Again, ask Mike and we can come and have a one-on-one with you about emails. So the other one is password protecting any documents that go out. Threat actors can access those PDFs within seconds and change bank details. They can change anything they want in there. Okay, so really make sure that you've got your email sorted and you have a really strong email policy. Make sure you delete it. When you delete it, your rubbish bin's deleted on a regular basis as well, because you can still access it, right? So really go into that. Now, I think we'll quickly run through this because we're running out of time. How to recognise you're under attack. No one's had a ransom, have they? No?
Once I've heard about it, one of the late practices for centralizing.
Yeah.
I see that happening.
Yeah. Ransom attacks are going up in Australia, especially in healthcare. There used to be the old, you're under attack, we've got your information, blog. So what do? You scream, you freak out, pull the plugs out of the wall, then you call us, right? Or call your IT person. Have a policy around that and actually make sure your staff are aware of that and they're trained in that as well. However, one of the new ransom attacks they're doing, and this is why we need a strong cybersecurity to make sure that we test everything, that everything is managed as we would expect it to. By the way, the Essential 8's only 8, there's 30 something of them. Now where was I at? So we need to, the new ransom that's happening is that they will say, we've removed some data or we've changed some data, but we're not going to tell you till you pay us. So you then cannot rely on any of that information being accurate. Do you need to report this to the OAIC? Is it a reportable event? Why do you say yes? Only since the last changes. Before that, it was non-reportable. Interesting, hey? I always thought it was reportable as well, but it wasn't until the last changes came in. Lots of different ways. Again, we'll send it to you. Should we pay the ransom? We've done that. So quickly, we'll go through what you need to do. Is you need to update your privacy policy, especially because the Privacy Commissioner is coming around. The APPs, remember the Australian Privacy Principles, number 1, in one of the subsections, it says if you have a website, they do expect it to be on the website. So don't think you shouldn't have it there. Make it easily accessible. I actually have called practices and go, I can't find it. And they're going, oh yeah, it's under this heading, this heading, this heading, and I've got about 10 clicks to find it. You've got to make it easily accessible. Okay. Cyber framework policy, go to the Australian Signals Directorate, look at what their templates have and use their templates. They are what we call the godfather of cybersecurity of Australia. They are so fantastic and got so many resources there. So use that as much as you can. Create, who's got an AI policy if you're using AI? Everyone got an AI policy? Yay, love you all. Now, secondary purposes. We need to disclose any secondary purposes. So in AI, this is one of the reasons of AI, is the AI that you're using it for training purposes of their LLMs, their large language models? That needs to be disclosed. So, and also make sure your cookies are in there. If you've got cookies for your website are in there as well. That's also in the APPs. Add staff and contractors to your privacy policy, training, and you document everything. So make sure everything is documented. If you have a privacy breach, the OIRC will want to go, what have you got? Show me your documentation, show me your risk register. Have you identified this as a risk? When we meet with APRA and the regulatory bodies, and they all say the same thing, they're not out to try to get you. What they want to know is that you've identified it, that you're working towards a solution, and you're willing to work towards a solution. They're going to nab you if you just go, I couldn't care less. So, which we do hear from time to time, not in those words, but they do say that. We did email, clear policy. Again, we'll send you all this. I'm not going to go into private Wi-Fi because I need to wrap up, but be careful if doctors are working at home. There's some information here about private Wi-Fi and public Wi-Fis and security. Australian Signals Directorate is another really good one. Not Australian Signals, Australian Health Digital Agency. I would recommend you all to sign up to do the Cyber Champions course with them. Brilliant course. It's 6 sessions over 12 weeks for about an hour and a half. Really doable, but it connects you in with a whole lot of other practices, but they also get guest speakers in from the other Australian agencies. So this is, I'll send this to you so you can get, have access to all this. Practical tips, again, I need to finish up. So this is just basically saying they've got to have a really good WAP3 and why they need to have it. That's the gold standard. So if your doctors are accessing at home under their own home private Wi-Fi, there are issues around that, as with phones. So we can send you all that information. Key points solid. So this is your management plan. What you need to do, develop it. So don't rush and think you need to get it done. Like I said, just be kind to yourself, kind to the business, and just work through it slowly. Work out what you need to do and action plan it out. Go, by end of June 2027, we're going to have all this underway. The key points for you is to have a culture of reporting, to make sure everyone gets trained in it. Really, really important. And you start working on and updating your policies and where you're missing gaps. Plan for a data breach, get your staff and go, hey, if this happens, if you have a business email compromise, what are you going to do about that? So it still does happen, even with a really good cyber framework. You're less likely to get any penalties if you've actually got the cyber framework set up. So they'll actually have a look at it. So this is the notifiable data breach scheme. Everyone's seen this? It'll be on the slide. We can send it to you again. Go see Michael. Love to talk to you all at the end of it. And I'm going to finish there. I think we've done some questions and I'm going to hand over to Michaela.
Thanks everyone, and thank you to Gail for such an engaging presentation. My name is Michaela. I'm one of the QI project officers in Kate's team here at Capital Health Network. And it's really nice to see some familiar faces in the audience tonight. I know I've met a few different people through different training and practice visits. Tonight, I am only going to take a few minutes of your time to give an update on better and faster access. So, as some of you may or may not know, legislative changes to Share by Default regarding pathology occurred in October 2025. So what is better and faster access? Well, better access is referring to the new legislative requirements for information to be shared with My Health Record by default. And at the moment, those changes from October 2025 are referring to pathology results. And then the faster component of this access is the removal of the 7-day delay to pathology results. So that can sound a little bit confusing, but just again, once to recap, better access is all pathology results being shared with My Health Record, aside from those that are in specific exempt categories. And faster access is removing the 7-day delay for patients. So previously, pathology was being reported. Patients were waiting 7 days before they could see that in their My Health Record. And now it's a legislative mandate and they get to access it straight away. So why has this system come about? Why have these changes occurred? So there are a few benefits of better and faster access for our health system. The hope is that there'll be less duplication and greater efficiency. So for GPs, that means not having to reorder pathology tests if a patient comes from a different practice or moves states or doesn't have a copy of the previous tests that they've had done. This means that they can make better informed decisions, and that might be within a practice or across teams between specialists and GPs. It supports our patients to make empowered decisions about their own healthcare, so giving them some control over their own health information. And it's a hope that there'll be improved safety and outcomes, so more transparency in the information of pathology results should help to reduce adverse outcomes, hospital admissions, and support safer care for patients. How did these decisions come about? So the clinical reference group was formed to provide advice and clinical oversight for the legislative changes that occurred and policy changes to support the new legislation. And if you'd like to find out some more information about who was involved in making these decisions, you can access it online or through the QR code. So as I mentioned, October 2025 was the date for pathology reporting, and March 2026, so in the next few weeks, is the plan for diagnostic imaging reporting. I'd just like to highlight here, this means that imaging reports will be mandated to be uploaded to My Health Record. However, images themselves will not be mandated to be uploaded. So reporting only. And the image on screen here gives an overview of some of the exceptions to these rules. So for pathology, it includes groups of tests such as anatomical, cytopathology, or genetic testing. Instead of their usual 7-day delay, these groups of tests will now have a 5-day delay to get to patients. And for imaging, there'll be no delay for x-rays of extremities. However, more involved imaging like MRIs and PET scans will still have the 5-day delay, and that will be from March 2026.
Sorry to stop you there. These are done by the pathologists, prospective pathologists who do the test.
Yes, so
They must be having those changes in the policies to upload in My Health Record certified.
correct, yes. So this is the responsibility of the providers, so the pathology or imaging providers, to upload. And there are a few exemptions to the rules. So patients can opt out of having their information uploaded to their My Health Record. And clinicians can also request that the requesting clinician, the person writing the pathology request, can also tick do not upload to My Health Record, but they have to discuss this with their patient and they have to document a clinical reason as to why they did not upload to My Health Record. So for sharing information to My Health Record by default, healthcare provider organisations can register and use conformant software. Changes are initially applying to pathology and diagnostic imaging, but there's still developments happening in this space, and impacted providers must share to My Health Record unless an exception applies, which is some of the things that I've already mentioned, or importantly, an extension of time to comply has been granted. What that means is we know that there are some providers out there who don't currently have the software to go live with this straight away. And in collaboration with the Australian Digital Health Agency, they've come to an agreement of a timeline in which they will upgrade their software to become conformant. So if you're experiencing this with a specific provider and you're not sure, is it just them avoiding their responsibilities or do they have an extension? They actually do have the providers with approved extensions published online if you need to find that information. And finally, we'll just touch on another tool that's come about for consumers or patients, and that's pathology tests explained. So this is an online platform for patients. They will have access to the link that takes them straight to this page from their My Health Record when they're reading their pathology reports. And it's a tool that patients can type in the test that they've had done, and it gives them a consumer-oriented explanation of what the test is. So it's trying to empower individuals to understand their own results.